Hi, my name's Dr. Comiskey with Moreland OB-GYN, and today I want to talk to you about having a pelvic exam. Whether you're having your first exam or you've been having exams for years, I think it's very helpful to understand exactly what's happening during the pelvic exam. So that's why I want to explain it to you. Most women find having a pelvic exam somewhat uncomfortable and anxiety provoking, but I think if you understand what's happening during the pelvic exam, it can go a long way to making you feel more comfortable. One of the main reasons that we do screening pelvic exams is to screen for cervical cancer or cervical precancer. In the past, cervical cancer screening was done using pap smears pretty much every year for a woman of any age who came in for a routine check. That has changed. We now do screening differently for women between the age of 21 and 30 and between the ages of 30 and 65, and then women 65 and up. But how we do the screening depends on the history of abnormal pap smears or the presence of any cervical cancer or precancer in the past. Before you have a pelvic exam, it's important to talk to your healthcare provider about what the goals of the exam are. Often we do an exam just for routine screening, to check for things even if we don't have any reason to believe that there's a problem, like a pap smear or routine screening for sexually transmitted infections. If you have a specific concern, it's important to tell your provider that ahead of time. If you've been having any symptoms of abnormal bleeding, abnormal discharge, itching, irritation, if you've had a known exposure to a new partner. Many women think that whenever they have a pelvic exam, particularly a speculum exam, that they're getting screened for all kinds of problems, and that's not really true. When we start the exam, we have to decide what all tests are we doing, and what are we checking for. First thing we'll do is have you sit up on the exam table. There are stirrups underneath the table that we can pull out. We have you put your feet in there and then slide your hips all the way down to the end of the table. The first thing we do is look at the outside, looking for any signs of issues or problems. So we're looking at the clitoris, the labia, the vaginal opening, and the anal area. Then we use a speculum to look inside the vagina and to look at the cervix and check the vaginal discharge. The speculum is the tool that we use in order to look inside the vagina and look at the cervix. It looks kind of intimidating and it looks like it could be sharp, but it's not. Most women who have used tampons or have had intercourse have minimal discomfort, but we always try to use the smallest one that we can in order to be able to see the structures that we need to see. At this point of the exam, we can do screening tests for cervical cancer or precancer. That's a pap smear and or an HPV test. We can also do screening for sexually transmitted infections. The spatula gets rubbed on the outside of the cervix to pick up some loose cells. Then we use a small brush, put that into the opening of the cervix and rotate it, again to pick up some loose cells. That specimen is put into a little jar of liquid and sent off to the lab so that it can be looked at under the microscope to check for abnormal cells. The screening tests for sexually transmitted infections are sometimes collected with the pap smear specimen, and sometimes they're collected separately by just using a swab to take a sample of the discharge from the cervix or from the vaginal discharge. Those are also sent off to the lab. So when we look through the speculum, we can't see the uterus, the fallopian tubes, or the ovaries. So in order to check those body organs, then we remove the speculum, and using one or two fingers in the vagina, whichever is comfortable, and the other hand up on the top of the lower abdomen, we feel the pelvic organs between our hands to check them. Sometimes we do a rectal exam at the same time. That can be uncomfortable. We try to do it only when it's necessary, but it is considered a normal part of the pelvic exam. I hope discussing this has made you feel more comfortable about having a pelvic exam. We're always willing to talk with you more, explain things in more detail, so please don't hesitate to ask. As always, it is Moreland OB-GYN's goal to lead women to better health.